So today we have planned to start our Big E exposure. How are you feeling?
Pretty anxious.
Yeah. That's pretty normal because we're asking you to do the thing that you've been avoiding doing that gives you a lot of anxiety for quite some time. And it would be pretty normal even if you kind of had urges to not come today. Maybe even turn and walk out the front door again. So well done for coming along. I know it can be a really big step to take.
Thank you.
But also demonstrates that you're willing and able to act against those anxious urges, which is really good for setting you up to do your exposure well. So today we'll have a chat about why we're doing exposure, so you kind of understand what we're looking for, and then we'll kind of plan out, we're going to do a few experiments with a couple of different sensations and figure out which ones are going to be the best ones for us to start with in terms of exposing you to the experiences associated with your panic attacks. And then we'll set you up for what you're going to do as homework this week and which sensations you're going to start your exposure homework on. Does that sound okay?
Yeah.
All right. So I know exposure is a really big word. You might have even had people talk to you about doing exposure. It might have even been that sense of, oh, just kind of jump in the deep end. If you kind of just get in and do it, then you'll be okay. Have you had those kind of messages?
Yeah, definitely.
Yeah. And what's your understanding of exposure and how it works?
Yeah, kind of exposing yourself to the thing that makes you anxious over and over again until it doesn't make you as anxious anymore, hopefully.
Yeah, that's the aim. And if we do this correctly, we actually can get a lot of bang for our buck out of these exposure sessions as well, or exposure tasks as well. And this is for a couple of different reasons. So I'll talk you through kind of what the reasons are that we're doing the exposure and how we're expecting it to work. The first thing is what we call habituation. But this is just a really fancy word for basically decreasing the sensitivity of that fear response, so it's not triggered quite so easily. And so how this works is, if you think about, if we have this kind of graph of this, over time, and this is how anxious we feel. And if we use maybe a different example, like that dog phobia example, what happens is if we come across a dog unexpectedly, quite obviously, we get a really sudden, sharp increase in our anxiety. And at this point, that's when we kind of tune in. We're like, oh my gosh, feeling really anxious, really freaking out. What's the urge that we have?
Run away.
Run away, yeah. And so that is kind of this. So we get that really sudden drop in anxiety because we've gotten the heck out of there. We're no longer in danger. So this is what happens when we avoid or we escape. And when we have catastrophic interpretations about our anxiety, often what happens at this point is we go, if I don't get out of here, what do I think is going to keep happening?
It's going to get more and more and more anxious, yeah.
Yeah. And we think it's going to be so overwhelming, we might actually end up fainting or going crazy, losing control, those kind of things. So this is what happens kind of when we listen to the anxiety voice telling us to avoid or escape. But what we actually know is that if we can sit and tolerate the feelings of anxiety without re-triggering ourselves into thinking about the threat and maintaining that level of danger that we perceive, the body systems that operate and kind of manage the fight or flight response will actually kick in and help us calm down. So we know that the parasympathetic nervous system will kind of kick in and start to slowly bring our system back to kind of that regular level. And it doesn't happen straight away, of course. It would be lovely if it did. It can take a bit of time, and that's why we might even find in the hours or even kind of the day after, we might feel a little bit more drained after we've had kind of a panic attack. But over time we know that it does decrease. Okay, so what we're looking at with panic attacks is that if we can sit and tolerate that anxiety and let it subside, we're actually going to be training our brain to realise that it's not such a catastrophe, that it doesn't actually go up here. And so the next time this happens and our anxiety gets triggered, so maybe the next time we come across a dog, anxiety might peak, but it might kind of peak a little bit lower and it might come down a little bit faster. And then the next time we come across a dog, it'll happen again. And the next time it might be here. Does that make sense?
Yeah.
So when we expose ourselves repeatedly to the thing that we're concerned about, and we can kind of sit and let that parasympathetic nervous system kick in and bring that anxiety down again, let the symptoms fade away, our body habituates to that really well. And so then it actually starts learning that it doesn't need to kick in that fear response as heavily as it was before. And so we're kind of changing where that threshold is. Does that make sense?
Yeah.
Okay. The other really cool thing that we get to do with exposure is challenge some of those catastrophic interpretations, if you can remember. That sense of, I'm going to faint, I might lose control, other people might judge me, I might go crazy. So at the moment, again, our brain is kind of going, that's what we're operating is the assumption. But we actually don't know, because we're not putting ourselves in those situations to find out whether it is true or not. So if we allow ourselves to do the exposure tasks, then it's going to give us the evidence one way or the other. So we'll actually know whether it is as catastrophic as our brain is telling us, or whether it might be a little bit different. Does that make sense?
Yeah.
Okay. So with all of that in mind, what we're going to do is first start with a bit of a menu of different things that we might be able to do in session, of how we elicit physical sensations that might be associated with your panic attacks. So we're going to work our way through each of them. We're going to do it together, so I'm not going to ask you to do anything that I'm not going to do. And what we want to get a sense of to start is how distressing they are. And to do that, we're going to use what we call SUDS, which is just a little acronym for our subjective units of distress. And we're going to rate these on a scale of 0 being totally fine, not bothered, 100 being complete panic stations. You know, we're right up here. So each time we're going to do one of these tasks, we're going to get a sense of what the SUDS rating is for you for doing that. We also want to get a sense of how intense the physical sensations that we induce are. We also want to get a sense of how similar they are to what you experience when you're having a real panic attack. And so we're going to use that to determine what are the sensations that we're going to do for our exposure that are going to really hit hard in terms of your panic attacks that you experience. Okay?
Yeah.
So we've got a menu here, and these are just some options. We can think of other ones as well that might work, but if you have a look down here, these are some of the tasks that we might do in session now that are going to induce the feelings that you have associated with your panic attacks. As you look at them, do any of them in particular jump out as really relevant or related to your panic attacks?
Maybe sort of breathing through a straw, or yeah, that kind of hyperventilation.
And because you know that they're really key symptoms for you, the breathing changes, the hyperventilation, maybe feeling a little bit dizzy as well. Okay. So we know that those ones might be good ones to start with. We'll work through all of them just to check, and because we know we might even be able to get at some of those same sensations through some of the other activities. Okay. So as we go, I'll do them and then you can do them after me, and we'll each do a rating of what our SUDS level is, how distressing it is, how similar they are for you for your panic attacks, and how intense they are, and just any other particular sensations that you note as we go. Okay? So let's get started. How do you feel about starting with the breathing through a straw?
Okay.
Yep.
Yeah, pretty anxious.
Willing to do it?
Yeah.
Yep.
We can give it a go.
So I'll let you choose which one you would like. Okay. Now, as we do this, you might have noticed, kind of anticipating that we're going to be starting, urges to do something that might be safety behaviours that will kind of help you get through doing this task without feeling too anxious. Did anything come up for you?
Yeah, I was kind of thinking about like breathing through the straw, but also breathing through the side of my mouth as well.
Yeah. So we really want to be on top of those, because sometimes they can be quite subtle. So anytime you're getting the urge to do something that might kind of help you feel a little bit less anxious, we really need to take note of those and do the opposite. So if we're not fully paying attention and fully going into the exposure task, we know we're not going to be eliciting the level of anxiety that we need for it to be effective. Okay. So knowing that is going to be the urge, making sure that we're breathing fully through the straw.
Yeah.
So what we'll do is we'll do this for a minute and we're just going to be holding our nose closed, so just breathing through your mouth, through the straw. Okay, so I'll go first, and you can time me, and then we'll swap over. Okay, so here we go. Okay, so if I was going to fill this out, I'd be writing, my SUDS level was probably about a 20, so I wasn't overly distressed. Intensity maybe about a 40 out of 100. And I noticed feeling a little bit lightheaded, and I certainly noticed a little bit of panic that I wasn't getting enough oxygen. Actually, I'd say that was probably a worry, so I was concerned that I wasn't getting enough oxygen, but I wasn't actually feeling quite anxious about it. Okay. So now it's your turn. Okay, so I'll time you. So when you're ready, if you close your nose with one hand and then breathe through the straw with the other. And stop. Okay. So now what I want you to do is just pop down in that first box there. The task was breathing through a straw. And then write down what your SUDS number was out of 100. And how similar that feeling is to a panic attack. And how intense it was for you to experience just now. Yep. And then any other physical sensations or responses that you noted. Okay, so how was that for you?
So I put down my SUDS as 80.
That was pretty high.
Yeah, pretty high.
Yeah.
Similarity was probably 70, and then intensity was probably about an 80 as well, so pretty high.
So that was a really intense experience for you, quite similar to what you have with panic attacks.
Yeah, definitely.
Okay. And what physical sensations did you notice?
I had a really tight chest and I felt quite dizzy,
And did you notice any other concerns or worries coming up as well about it might become a panic attack?
Yeah, I was thinking that a little bit.
Yeah, so that was coming up for you as well.
Yeah.
Okay. All right, so we've got that one and we know that that's quite similar. Let's try our next one, which is going to be hyperventilating. Okay. And so again, we're getting at that kind of the breath, the changes in breathing that you're experiencing with your panic attacks. And so what we're going to do with hyperventilating is breathing in and out quite fast and quite loud. Okay, so you might feel a little bit silly doing this. I'll do it first. I really want to get that sense of particularly breathing out quite a lot. So we're going to be breathing fast and making sure we're breathing out because we're trying to get at what we're experiencing in a panic attack, which is expelling too much carbon dioxide through that fast rate of breathing when we're not actually producing as much carbon dioxide as an off product of if we were actually in that fight or flight situation where we had to respond. Okay. What we're going to do is get you to do it for 1 minute. So you can count me first and then I'll count you. Okay. Stop. Okay. All right. So for me, I would say that was feeling very lightheaded, very dizzy, kind of like the room spinning a little bit, and quite intense as well. So that was probably an 80 or 90 for me. Okay. All right. When you're ready, you get started. Okay, and stop. Okay. So, the same one, jotting down there.
Yeah.
What your SUDS rating is. How intense they were, how similar they were, and other sensations that you noticed.
Yeah.
Okay. So how was that one for you?
That was really high. That was all 95 for all of them.
95, okay. Yeah. So pretty much spot on to what you would experience normally.
Yeah, definitely.
Yeah. Okay. And what other sensations did you notice?
I was really dizzy. I could feel my face getting really flushed, quite nauseous. Yeah.
So what we want to do now is have a look at which of those different exposure exercises we want to get started with. So I know we've got quite a few that are similar to the panic attacks you have. We want to have a look at any that are probably over about a 40% similarity. And within those, then we want to look at which ones are the highest versus the lowest of that SUDS rating. So if you want to have a look at the ones you've got written down there. So what we want to do is start with the one that is the highest SUDS rating that you're willing to tolerate. Often we look at this as maybe a 40 or a 50. We can go higher if you're willing to go higher. But again, we're taking that kind of graded approach. So we want to start with the one that's still challenging but manageable for you. So having a look at the exercises that you have there, which one do you think that is quite similar to the panic attacks you've had that you'd be willing to start with?
I could probably do the straw one again.
The straw one?
Yeah.
And what was the SUDS on that one?
That was an 80.
That's an 80?
Yeah.
So that's pretty high to start with.
Yeah.
Is that something that you think you're willing to do and that you think you can tolerate?
I think so. I think kind of once I did the other ones and realised they were like a lot higher.
Yeah.
Yeah, I think I can do that one.
Okay, fantastic. And I think that's really good because if we're starting at an 80, that gives us lots of room for improvement as well. We'll work our way through that hierarchy quite quickly. So what we'll get you to do is do that same exercise, so breathing through a straw for a minute at a time every day for the next week. And this is because we want to get that repetition happening quite quickly in order to get that decrease in the fear response. And if we leave it too long, it's a bit harder for that to happen quite as fast. And we want to get this happening as quickly as we can. Yeah. When you do it, it's kind of up to you whether you want to kind of get it out of the way in the day, if you want to do it fit in the evening. What we would also say that kind of helps in making exposure as effective as possible is when you do it, making sure you get a good sleep after. So sometimes you might find in the afternoon or evening might be beneficial because we know that once you're sleeping, your brain consolidates the learning that you've had that day. So when you're learning this and we're kind of testing out those fears, we want to be consolidating that learning as much as possible. Is there anything you think that might get in the way of you doing these exposure tasks this week?
Just kind of life, normal things, kind of responsibilities and things like that.
Okay, is there anything in particular that you have coming up that's going to be tricky?
No, not really this week.
Okay, yeah, fantastic. And again, you might find that things do come up during the day, so we want to make sure we can get it in wherever we possibly can. So if something does come up, if plans change and things happen unexpectedly, you might miss a day. If we can try and fit it in somewhere, or you might want to do two the next day, so one in the morning and one in the evening. Okay. And you might also just want to note down any other changes or kind of reflections after you've done it. So the physical sensations you noticed, what kind of thoughts came up for you, any changes that were happening just as you reflect on the experience afterwards. Okay. Do you feel confident that you'll be able to do that this week?
Yeah, I can definitely give it a go.
Okay, fantastic.